Introduction. The article Virtual Reality Technology for Surgical Learning Qualitative Outcomes of the First Virtual Reality Training Course for Emergency and Essential Surgery delivered by a UK-Uganda partnership by Please et al. 2024 in BMJ Open Quality, Volume 13, Issue 1, pages 1 through 11 is an article written about the effects of 360-degree virtual reality surgical training. The authors delve into the reactions of those who took a course containing virtual reality. Furthermore, they address ethical worries as well as possible uses in the future of virtual reality for surgery learning. The methods. Please et al. 2024 explained that after a pilot study was conducted regarding virtual reality, as well as in-person learning of surgical techniques, with the virtual reality participants using 360-degree visuals, a main study was done consisting of 10 people from Brighton who trained in person, at maximum 30 people from Kampala who initiated in virtual surgical learning via in-person centers where the virtual reality headsets were offered, and an unlimited number of people who could access it from anywhere as long as they had a headset, laptop, or phone. The 4-day course was conducted in April of 2022. UK students were also allowed access to the same virtual videos as the other participants, but only for 15 minutes at a time. Similarly, the Kampala students accessed either an Oculus Quest 2 or a cardboard headset for 15 minutes each time. The survey. Please et al. Say that data was collected from students before and after the course was taken. These questions asked about if virtual reality encouraged them to take the course, how easy the virtual reality was, and about possible uses of virtual reality locally in clinical settings. The students were given a survey at the beginning and end of each study day, except UK students who participated in surveys 5 months after completion in order to get a better idea of the effects that the course would have long term. Interview methods. Please et al. 2024 indicates that 14 interviews were conducted. Furthermore, 100% of the UK students participated in an end-of-course interview. The remaining 4 were interviewed via Zoom. Virtual reality program. In order to teach subjects, most of them were preceded by a 10-minute lecture. Then cadavers were used, or in some cases mannequins, to demonstrate the talked about procedure. Please et al. 2024 further explains that the UK students always chose to train without virtual reality, except when they used it for 15 minutes each day, while Kampala students mainly used cardboard headsets. The demographics. The demographics of the students were also gathered by Please et al. 2024. 92.4% of Kampala's participants had never used virtual reality headsets before. Remote students appeared to share devices, because despite 617 people giving feedback on the course, only 556 people were reported online as having used the resource. The remote students came from 25 countries. Data from survey. A high percentage of students from each group reported on the survey. Please et al. 2024 says that UK delegates who studied in person claimed to have been greatly affected by the course 5 months later in clinical settings. Furthermore, 10% of all delegates use skills learned daily, 60% a majority of days, 10% every fortnight, and 20% every month. 60% claimed that they had improved clinical practice due to virtual reality. 80% of students also claimed that their patient assessments had improved. Furthermore, most live stream users claimed that the virtual reality accessibility was easy to attain, that virtual reality was a main reason to take the class, that it does have applications in learning surgical techniques locally, curriculum, as well as practicing surgeries. However, the largest issue with having access to course material was bad internet. Interview data. Please et al. 2024 say that some of those interviewed described their previous lack of learning options beyond a bachelor's degree. Another reason given was the cost of further study, which interviewees found demotivating. Furthermore, operating theaters threaten the patient's safety through congestion. Thus, virtual reality is believed to be able to fill in the gap caused by these problems. The participants also appreciated the 360-degree aspect of the procedures as it let them see the procedure better than before possible and let them move their point of view. However, a concern for complex procedures needing in-person learning was expressed. Those interviewed explained that the cost of equipment or data for phones is a hindrance for virtual technology. Also, fatigue and generational bias were listed as downsides. The discussions. Please et al. 2024 explains that the diverse participation rate for this study shows a strong interest in virtual reality training for postgraduate learners. Those interviewed liked that they could see more angles of a procedure and that virtual reality helped bring distant professionals closer together. The authors further believe that reactions to the course show potential that will be explored in the future. The possibility of using both virtual reality learning and in-person learning together is mentioned. An option is mentioned that involves building centers dedicated to virtual reality learning that would help bypass the issue of bad internet connections. The authors also believe the benefits to the environment, connectivity of delegates, the easy enlargement of the scale of use of virtual reality, and the ability for possible internet expansion to rural places are possible. Issues were also mentioned regarding scholars travel for the study, as well as the issue that no control group was used, which the authors wish to fix in a future study that will explore other topics related to the current study. To remedy the ethical concerns of delegates only having learned surgical procedures via virtual reality, only those who had at least formally studied in the past participated. The conclusion. Finally, Please et al. 2024 find the results of the study to be encouragement. They believe that many people are eager to use virtual reality in this capacity. Kenya is assumed to be the place where more work will be done related to this study. The authors further believe that other places besides the continents listed in their study can be helped as well.